Hello everyone, this is my concept mapping. Uh, First I start with, of course, it is the pulmonary system and defining the two terms, which is ventilation and diffusion. So in ventilation, it is, of course, the process that acquires O2 needed for cell metabolism, removes CO2 needed to maintain pH and optimal cell functioning. Ventilation is altered by inhibition of neuronal stimulation and mechanical breathing, and obstruction or restrictions of airflow. Now, for diffusion, it is the exchange of O2 and CO2 at the alveolar capillary junction, ACJ. Some of the things that it is altered by its increased thickness of the ACJ, decreased surface area of the ACJ, and decreased partial pressure and decreased solubility. Now, for the diseases associated with the pulmonary system, we can start with pneumonia. And one of the treatment options for pneumonia, it can refers to antibiotics depending on the severity, and fever reducers and pain relievers. For COPD, short-term acting bronchodilators and long-term acting bronchodilators and inhaled steroids. And of course, smoking cessation if applicable. Now, in cases of emphysema, the treatment options include bronchodilators, inhaled steroids and antibiotics, and supplemental oxygen and pulmonary rehabilitation. In cases of chronic bronchitis, it is again smoke cessation if applicable, and bronchodilators and steroid anti-inflammatory drugs. Cases of asthma, one of the first courses of action when it comes to medications include inhaled corticosteroids and anti-inflammatory drugs, and of course controlling environmental triggers. Cases of cystic fibrosis, the course of action with medications include antibiotics, anti-inflammatory medications, and bronchodilators. Pulmonary rehabilitation and diet, and lung transplantations at the end stages. For ARDS, supplemental oxygen and mechanical ventilation or mechanical ventilation. Now, the concept that was a little difficult for me to understand, and after doing the mapping became significantly more clear, was understanding the difference between ventilation and diffusion, and which one was acquiring or exchanging CO2 and O2. And after I completed this map, everything became significantly more clear and easier to understand. I think just having the two definitions became easier for even me picture that in my head, and also to understand the pulmonary system a little better. Thank you.